All right. We'll give it just a minute. I know we've got 67 participants on so far. I know we have a lot to go over, so we want to make sure that we get everything in. I see people are already participating in the Q&A and the chat boxes. All right, well, we'll go ahead and get started. Hi, everybody. Thank you for joining us. My name is Christy Reister. I am the Executive Director for the Council for the Model Aquatic Health Code. Thank you so much for sending in your questions. I know that there's a lot of people that are getting ready to reopen and have several questions about the best practices and best way to do this. We have a phenomenal panel of speakers that are going to be answering your questions and going through, all of those burning questions that have been coming up. I do want to let you know that we have the Q&A box that is being monitored throughout this webinar, along with the chat box. So please feel free to include any other questions that you need answers to that maybe we don't cover, or anything in the chat box that you want to add. And once we get through all of the questions that we had already received that are going to be answered through the presentation, we will definitely get to those questions in the Q&A and in the chat box. So those are open as well. We do have, we'll move, yes, to the introduction here and the agenda. We have some poll questions, as I mentioned. We'll be doing that in just a minute. We'll start with our first poll question, and really want to encourage you to participate. I think it'll be really helpful to for everyone participating on the webinar today to hear what is going on around, in other facilities and places. So please participate in those. I'll introduce the speakers. We will go over the CDC COVID-19 considerations for public aquatic venues, and then answer all of your member questions that have come in regarding the COVID lab and disinfection data, the lifeguarding, swim lessons, water playgrounds, indoor versus outdoor pools, the disinfection protocols, other operational questions, and just looking forward. Then again, we'll open it with our Q&A and any member sharing, and then close the webinar. So with that, let's get to the first poll question. So are pools in your jurisdiction open? If not, when do you anticipate opening? So please go ahead and cast your poll. We'll give you about 20 more seconds to please cast your poll, and then we will show the results. Okay, looks like a lot of you do not have your facilities open. 87% said no, 13% said yes. And it looks like there are several that are planning to open in June and some in July. So hopefully this is helpful for everybody that's attending to kind of see what is going on in other facilities. All right. Well, with that, I'd like to introduce our speakers. We have Dewey Case. He is our CMAHC Technical Director, who will be on the webinar with y'all, as well as Michelle Helvasa. She is the CDC's Chief of Healthy Swimming. And Jennifer Murphy, she is on the CDC Water Sanitation and Hygiene Team Lead and Community Intervention and At-Risk Task Force, CDC COVID-19 response. So with that, I will turn it over to Dewey, and we'll take it from there. Thank you.
Great, thank you, everyone. So, as we know, CDC released their guidelines back in last week, and lots of information there to be had. So, with that being said, we're going to go ahead and turn it over and have Jen give us a start as we talk about COVID-19. Jen?
Okay, thanks a lot. Thank you all for allowing us to speak today. So I'm going to just start off with some pretty basic background information about COVID-19, and then I'll turn it over to Michelle to talk more specifically about these new considerations that we have put out that Dewey mentioned. Okay, so just a quick overview of what we'll talk about. I'll just go over some disease and prevention information, talk a little bit about cleaning and disinfection, and then we'll jump into the public aquatic venues considerations documents, and then follow up with some resources that we've prepared. Okay, so to start off with some basic background information on COVID-19, what we know is that the disease is caused by the virus SARS-CoV-2. So a lot of us kind of know this information already, but wanted to just put it out there to start the discussion. The first US case was reported in January of 2020. And as of yesterday, there were 1.48 million cases in the United States and almost 90,000 deaths from COVID-19. These confirmed cases have come from all 50 states and from 8 US affiliated jurisdictions. And you can see the link here that will provide you day-to-day updated numbers on cases in the US if that's something you want to follow. So what we do know about this disease, we know how it spreads and that it spreads mainly from person to person. So this is between people who are in close contact with one another. And so we generally say this is within about 6 feet from each other. And it's spread through respiratory droplets. These are produced when a person who's infected coughs, sneezes, or talks. And so what happens is these droplets can then land into the mouths or noses of people who are standing nearby and possibly inhaled into their lungs. We also know that people without symptoms may be able to spread COVID-19. So asymptomatic people through just talking, coughing, sneezing may be able to spread the disease and not even know that they have it. You might be able to get COVID-19 by touching a surface or an object that has the virus on it and then touching your mouth, your nose, or your eyes. So some of the symptoms and complications. So the main symptoms, the defined symptoms of COVID-19 include cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat. And then more recently, this new loss of taste or smell is one that's come onto the symptoms list. There's a wide range of illness, so mild to severe. And as we know, this disease can result in death. The estimated incubation period is 2 to 14 days. And there are a number of complications that can arise from the infection. So pneumonia, respiratory failure, and multi-system organ failure are big ones. We've got a link here for our symptom self-checker. So this is a resource on CDC's website where you can go in and enter information about the kinds of symptoms you have, and it kind of can give you some guidance on what to do about that. Next slide, please. Okay, so there's a number of ways that you can protect yourself, and we'll probably hit on these a lot of times. You'll hear this in Michelle's presentation. But really the big ones are here. Avoid touching your eyes, nose, and mouth when your hands aren't washed. That's probably one of the biggest ways to prevent the spread of the disease. Avoid close contact with people when you're not at home. So this is what we call social distancing or physical distancing. Washing your hands often with soap and water, and we say for at least 20 seconds. It's singing happy birthday twice is the gauge that a lot of people use. You can also use an alcohol-based hand sanitizer, and so that hand sanitizer should contain at least 60% alcohol, and that's if you don't have soap and water readily available. And then cleaning and disinfecting frequently touched surfaces and objects is another big one for protecting yourself. There's some other things you can do to protect others, and this applies really for all respiratory illnesses. So the big one is stay at home when you are sick. Practicing respiratory etiquette, which is basically covering your cough or sneeze with a tissue or using the inside of your elbow, and then throwing away any used tissues and washing your hands immediately afterwards. We also say avoid close contact with people when you're not at home, so social distancing. And then wearing a cloth face covering over your nose and mouth when you're in public. So this is especially important in situations when you're going to be around people and where social distancing is really difficult. We do want to note that the cloth face coverings are not a substitute for social distancing. It's just an extra precaution that you can take when you are out in public. So social distancing really is one of the most important things that can slow the spread of COVID-19. So again, that's staying at least 6 feet apart from other people, not gathering in groups, staying out of crowded places and avoiding mass gatherings. And again, wearing this cloth face covering, especially when you're going to be close to people when you're out in public. So just a couple of slides here on cleaning and disinfection. A couple of weeks ago, CDC worked with EPA to develop a reopening guidance for cleaning and disinfection. So this information is coming out of that guidance document. And so there's 3 main principles for cleaning and disinfection that we talk about. So cleaning and disinfection should be effective, it should be efficient, and it should be safe. So we'll start with the effective component. So the recommendation that we have is to clean first. So that really just means using soap and water to clean a surface or object, especially if the surface is visibly dirty, but really just all the time. Cleaning first, that allows your disinfectant to work properly. So you're getting some of the organics or other materials out of the way. You can also remove some viruses physically from the surface from this cleaning step. And then we advise using a disinfectant from List N. So this List N is a list of about 400 disinfectant products that EPA has registered for use against SARS-CoV-2. So there's a lot of different options within this list and a lot of different methods of application. So you can get into, if you click on this link, you can go in and kind of see what's out there, see what might work in a different venue and different application types that are that EPA has approved. It's important to remember to follow the manufacturer's instructions. So this, again, and I think, a lot of people in the aquatics industry are very familiar with this. So application method and then contact time. Those 2 things are really important to make sure that you're using the product properly. And then we do say that if List N disinfectants, and these are, again, surface disinfectants, are not available, that you can make a dilution of household bleach. That's 1/3 cup of bleach into a gallon of water. And this can be used if you're having trouble procuring any of these List N disinfectants. So secondly, we say that disinfection should be efficient. And so what that means is that you really just want to focus on the surfaces and objects that are touched frequently by a number of different people. So things like doorknobs, light switches, faucets, bathroom faucets are a big one that I think sometimes people forget. Tables, countertops, remote controls, those kinds of things really do get a lot of touch by a lot of different people. And those are the ones to think about when you're making your plan for cleaning and disinfecting in your space. There are some surfaces that really just don't need to be disinfected, and it's important to be mindful of those. We know disinfectant shortages may be a problem in the coming months, and so it's good to have a nice plan and really not overuse disinfectants when it's not necessary. So surfaces and objects that aren't touched a lot don't really need to be disinfected. These can just go through their normal routine cleaning, and that should be enough. Things like walls and floors and sidewalks, those kinds of areas do not need to be disinfected. And again, if you've had a space that's been closed and no one's been in it for at least 7 days, then that area just needs routine cleaning. It doesn't need any disinfection. That's due to virus die-off. And then lastly, cleaning and disinfection should be safe. So it's just really important to make sure that your staff are instructed on how to apply these disinfectants exactly according to the label, so you know that they're working properly, using the correct concentration, making sure that they have PPE that's available and that's required by that particular product. And again, ensuring sufficient ventilation for disinfectants that are being used. And then I think, you know, of course, keeping disinfectants out of the reach of any children and storing them appropriately for the type of disinfectant that they are. So those are some just really general overarching cleaning and disinfection information, but we've got this document that I mentioned online. And so if you are interested, you can have a look at that. And there's a number of different resources on the website that give more information about cleaning and disinfecting. So I'm going to turn this over to Michelle. I think she's going to give an overview of our new considerations document.
Thank you, Jen. Next slide. So I'm going to cover in this presentation basically how we here at CDC recommend or ask operators to consider operating and managing public aquatic venues. This presentation includes considerations for the safety of those who operate and manage public pools, hot tubs, and water playgrounds, and those who use them. All decisions about implementing these considerations should be made locally in collaboration with public health officials. So in the next few slides, I'm going to cover promoting behaviors that prevent the spread of COVID-19, maintaining healthy environments, maintaining healthy operations, and preparing for when someone gets sick. So what are we talking about when we're saying promoting behaviors? Next slide. Well, a lot of it comes down to hand washing and cloth face coverings. So we are asking operators to consider encouraging all staff, patrons, and swimmers to wash their hands often and to cover their coughs and sneezes, and to make sure there's adequate supplies to support good, healthy hygiene, such as soap, hand sanitizers, paper towels, tissues, and no-touch trash cans. We're also asking for encouraging of the use of cloth face covers as feasible. One thing to keep in mind, unlike in other venues, we need to keep in mind that we shouldn't be wearing these cloth face coverings all the time, but for example, not in the water. It's really difficult to breathe through them when they're wet. Next slide. And the biggest take home is staying home when you're sick. So educating staff, patrons, and swimmers about when to stay home. So if they have symptoms of COVID-19, if they test positive for COVID-19, or if they've been exposed to someone with COVID-19 in the last 14 days, they should not be coming to a public aquatic venue. In terms of signs and messages, CDC has a whole suite of messages that pool operators can take advantage of, and we ask them to post signs about stopping the spread of COVID-19, to properly wash hands, to promote everyday protective measures such as the cloth face coverings, and to properly use cloth face coverings in highly visible locations. So here the highly visible locations we're referring to where to post the signs. Posting a sign behind a pole is not going to be particularly helpful. Also, at the end of this presentation, you'll see links so where you can get these promotion materials, whether they be posters, messages for the PA or public announcement systems, or stuff that you can post on your website, buttons and badges. We ask for inclusion of messages about these behaviors that prevent the spread of COVID-19 in contracts with individual patrons or households, in emails, on the facility's website, through the facility's social media accounts, and on entrance tickets. Maintaining healthy environments. So here we're talking about what Jen had discussed before, the cleaning and disinfection. So we're cleaning and disinfecting frequently touched surfaces touched by multiple people, at least daily, and shared objects as well. And those are going to be cleaned and disinfected between each user. So we're talking handrails, we're talking slides, we're talking water structures for climbing and playing. We're talking about lounge chairs and tabletops and pool noodles and kickboards, as well as door handles and surfaces in restrooms and hand washing stations, diaper changing stations, and showers. As Jen had mentioned earlier, EPA has a list of disinfectants, the list N, for which disinfectants are optional. Now, disinfectants could potentially damage the equipment or the structure of the aquatic venue, so we do recommend reaching out to the manufacturer of the equipment or the designer or who created the aquatic venue, who designed the aquatic venue. Check in with them about which disinfectant is best. There's over 400 disinfectants listed, and some might be better for your venue than others. And whenever we're using chemicals, whether they're pool chemicals or disinfectants for surfaces, we need to make sure we're using them safely and correctly, and we also need to make sure we're storing them safely, and this includes storing products securely away from small children. And of course, as we keep hearing, we need to be social distancing. So how do we support our patrons and our staff in doing that? So we're talking now about modifying layouts, changing the deck layouts to make sure that people are at least 6 feet apart from those they don't live with. We're talking about providing physical barriers and guides. In terms of physical barriers or guides, we're talking about lane lines in the water or chairs and tables on the deck, and as well as visual guides or cues, such as tape on the decks, floors and sidewalks, and putting signs. This isn't going to be much different from what we see in the grocery stores and other public settings. As far as communal spaces and shared objects, consider staggering the use of communal spaces, whether it's the water itself in the aquatic venue or in the break room or restrooms. Clean and disinfect frequently touched surfaces at least daily, and more frequently based on the use of restrooms, for example, or handrails. Discourage people from sharing items that are difficult to clean, sanitize, or disinfect, or that are meant to come in contact with the face, such as nose clips, goggles, and snorkels. Discourage the sharing of items such as food, equipment, toys, and supplies. And in terms of maintaining healthy operations, think about your staffing. Consider protections for vulnerable staff. For example, allowing them to telework or have modified job responsibilities where they have less exposure to others, for example. Ensuring lifeguards are, when they're on active duty, when they're actively lifeguarding, they should not also be monitoring hand washing and use of cloth face coverings or social distancing. They should just be focused on the lifeguarding. Implementing sick leave policies and practices for staff that are flexible and non-punitive. Training staff on all safety protocols and conducting daily health checks, for example, temperature screening or symptom checking of staff. For gatherings, we want to avoid group events, gatherings or meetings both in and out of the water. If we're not going to be able to social distance at least 6 feet between people who don't live together. Exceptions to social distancing in the guidance include rescuing a distressed swimmer. No public aquatic venue should be open if we're not prepared to rescue distressed swimmers. Another exception is providing first aid and performing CPR. Individuals in the process of evacuating an aquatic venue because of an imminent hazard, such as a fecal incident in the water or a distressed swimmer needing to be rescued, or even evacuating the facility in case of an emergency. Again, social distancing should take the back seat to that. Be aware that local and state regulatory agencies might have different policies on gathering requirements, so that might vary across localities and states. Okay, and finally, preparing for when someone gets sick at your aquatic facility. So you're going to isolate and transport the people who are sick to their home or to a healthcare provider. And you're going to immediately separate this sick person, whether they be staff, patrons, or swimmers with the COVID-19 symptoms. And you're going to notify health officials and close contacts as allowed. Okay, and then after this person has left the premises, you're going to clean and disinfect the areas that the sick person was in. So this means closing off areas used by the sick person until after cleaning and disinfecting, waiting more than 24 hours before cleaning and disinfecting these areas, and ensuring safe and correct use, again, of the disinfectants approved by EPA, so list and EPA-approved disinfectants. And safe storage and usage includes storing products securely away from young children. And here are the resources Jen and I have been referring to throughout the slides, so they're just summarized here. And I guess I'll turn it back over to CMAHC.
Great, thank you, Michelle. Before we move on to the rest of the Q&A, we have our second poll question. And again, we'll give you approximately 1 minute to complete the poll. Do you plan to use any part of the CDC guidance, either in providing guidance to local facilities in your jurisdiction or when reopening your aquatic venue? So that's our poll question. And if you would answer that, and we'll give you approximately 1 minute. Great. So overwhelming majority of us plan on using this guidance, and that is great to know and great to hear. I do want to give thanks to the staff at CDC, to Michelle, to Joe, to Jen, and everyone involved in responding, not only in general to the COVID-19 pandemic, but specifically to our application in the aquatic environment. There's been a ton of work and a ton of thought put into the guidance and into the guidelines. And, you know, just publicly, I want to thank the team for the work they've put in and also for supporting healthy swimming in our aquatic facilities across the country. So with our questions, we had 62 questions. They were very much outstanding, and I want to thank all the members who sent those in. What we've tried to do is we've tried to categorize these questions into relevant groupings to where we can attempt to answer all of them. If you have a specific question that has not been answered, please feel free to put that into the Q&A box, as several of you have already done, and we'll try to get to that as soon as we can at the end of the webinar. We had several questions about lab and disinfection data for COVID-19. So I want to bring Jen Murphy back in with the WASH team at CDC to help answer some of these questions. So Jen, we have some of the slides up, or some of the questions up. Can you talk a little bit about the CT values and dose? Can you talk about the viability of SARS, as well as what other recommendations you may have for lakes and disinfectants, and also we'll save the UV rays and disinfection for last. But Jen, if you would.
So, and thank you all. It's great to hear that feedback that these considerations and recommendations will be useful in your venues, and we've put a lot of thought into these, and it is a challenge to create guidance that spans across so many different iterations of facilities, and we know that each one is unique and has its own challenges. So we hope that you'll be able to apply some of these big picture principles your spaces and help keep them healthy and still be able to operate and function this summer. So what I can say about disinfection in general is that we really just don't know a lot yet about this virus. So there have been a few studies, you may have seen some of them really just in the last month or two that have come out in the peer-reviewed literature. We do know that, we have at least one study that found that the virus was undetectable in a 1 to 50 dilution of household bleach. So that's 1,000 parts per million after a 5-minute contact time. But unfortunately in this study, 5 minutes was the first time point that they tested. So, we have data from other similar coronaviruses, and they've been shown to be inactivated on both surfaces and in suspensions within a minute at this concentration. So again, I think there's still a lot to learn about this virus and how it behaves. I don't necessarily think it will be a lot different than other similar viruses. There are studies going on. We actually aren't doing any of this type of disinfection work at CDC. Right now, we don't have plans to do that, but we do know a lot of researchers out there are looking into this. They're working on CT values, really trying to learn more about how this virus behaves with different disinfectants. So I expect that data will come out over the coming months and years, and certainly, we stay on top of that. We try to see what comes through and really update our recommendations as we get more information out of those kinds of studies. So to date, there's no known evidence that that COVID-19 can be spread through water. We don't have any epi studies suggesting that, any epi data suggesting that. And again, we think that the virus should be susceptible to chlorine. So, at this time we say there's very low risk associated with swimming in terms of being exposed through the actual water itself. Again, if you look at that data that I was just speaking about, the 1,000 parts per million chlorine data for inactivation of the virus, that's quite a bit higher than what a pool is normally treated at, so 1 to 2 parts per million free chlorine, and of course we think that's that chlorine's going to be it's going to inactivate the virus. The contact times for that will be longer. So what we're looking at with, and I think a lot of people have asked questions about this. Well, can we just put our our rafts and our pool toys just in the pool water to disinfect them, and we're really we keep going back to this EPA list in disinfectants, and that's really because of contact time. So if you have one of these disinfectants, or you make a chlorine solution that's 1,000 parts per million, that's going to give you a quick surface disinfection, and I think that's not to say that pool water itself isn't disinfecting to some extent, and we'll learn more about that over time. But really using that strong concentration is going to be a quick and effective way to really make sure that these shared objects and surfaces that are touched a lot are properly disinfected. So yeah, I think I just keep going back to that list in. EPA is doing a really good job fast tracking the way that they are adding things to this list. It first started off with just a handful of different disinfectants, like Michelle and I both said. They're now up to about 400 of them. They've now also included a way to search by application method. So we get a lot of questions about electrostatic sprayers and foggers and that kind of thing. So you can actually look on that within their website and kind of pick and choose what kinds of disinfectants might be best for your application. So yeah, I think, we just kind of keep going back to that list. And really, I think one of the most important things to do is really develop the plan for the venue. So before it opens, go into your venue. Every single one is unique, has its own, special situations with the way the bathrooms are laid out, or how handrails are within the venue, and make a plan. Think through Is this area one that gets a lot of touch? Do we remember this previously? Is this an area where people tend to congregate? Should we focus our cleaning and disinfection in this particular area? You know, make sure that you're able to use your disinfectants in a way that's going to, you know, get the most bang for the buck. You know, bleaching all the pool decks, you know, isn't necessarily going to be the best use of a disinfectant if you're doing that constantly all summer. And so really getting in there, making a plan, making a cleaning schedule, really thinking through how to do that with the staff that you have really is, I think, one of the most valuable things you can do right before you open up. I see there's a question about UV rays. We get this one a lot. You know, I think viruses are, they are inactivated by UV. So I would say that's like a little extra for you on there. That's just like one little extra bit of protection, but it's certainly not the means to rely on for inactivating the virus in your setting. Because we know UV can vary depending on the cloud cover and, you know, where you're located. There's a lot of different variables in there that make using UV as like your primary disinfectant is, you know, if you're thinking about it as from like the sun, for example. Now, I know a lot of pools do use UV, you know, within their treatment. Of course, that's also going to be efficacious to inactivating the virus. But again, we just still keep going back to those disinfectants. UV is not, it's not a surface disinfectant, so it's not on list in. I know there's a lot of groups looking at UV as a method for disinfecting surfaces. So, you know, again, we don't have the data on that, so we can't say much to that. But I think, you know, really sticking to those surface disinfectants and having a good plan in place is the best way to go. I don't know if that covered everything. Oh, I just see one last thing about freshwater lakes. That's another one that we do get a lot of questions about. And again, we don't really have any evidence that there's spread through, you know, untreated recreational water, even if it is potentially contaminated by fecal sources. So we kind of really think that this could be possible, but there's really no evidence to date. So really the risk is considered very low for ambient untreated recreational water. So if you're swimming or boating like in a lake. So we just kind of focus again on just the people who are recreating can take steps to protect themselves. Some of the steps we noted earlier. And we're of course reviewing data on this and we'll update recommendations as soon as we have more information. So hopefully that cover everything.
Yeah, I think so. You know, Jen, on just a quick question, kind of off script, you know, one thing that may be in our favor in swimming pools and even in lakes is the dilution factor
Yes.
of the water. Is that a valid thing in your opinion, where that adds to the lessened risk for water transmission?
Yeah, I think so. And, you know, I mean, we know that the main route of exposure is really through those droplets. So once something is in water and then immediately diluted, that, you know, the chance of that aerosolization and then exposure is just, it's different than if someone, for example, coughs, you know, within, you know, 3 feet of you. So, you know, certainly, you know, that dilution effect in general, I think for water related diseases is something that does reduce your risk just in general. So yeah, I think, so dilution, I would say that part kind of helps as well, for sure.
Great. Jen, thank you so much for your expertise and for your input. Same with Michelle. And I am quite sure that we will be deferring to you later on in our chat this morning. So we've gotten a lot of questions about lifeguard training and lifeguarding, and this has been a very hot topic across the industry as we look at reopening facilities. You know, so to highlight some of these, as far as lifeguards' personal protective equipment, We are recommending, and we do see this reflected in the guidelines, that lifeguards wear a mask while on the stand. Again, it needs to be removed for water rescues. Apart from that, there's no real major changes to PPE. We still have our gloves and personal protective equipment. I have seen some references to using face shields, but as a reminder, face shields don't do a whole lot of good in preventing aerosols from entering into the body through the respiratory tract. They really just function as a splash guard. So they may help to some degree, but still having that mask on will do probably the better good rather than a face shield. The question regarding disinfection of lifeguard stations and supplies, it all goes down to this high touch and high frequency cleaning. Certainly we want to make sure that our staff is just as protected as the general public. So having a routine in place and a schedule in place of what equipment needs to be disinfected is going to depend on the facility. For example, if you have the ability as an agency to have one rescue tube assigned to a lifeguard for the entire duration of the shift, same thing with other personal protective equipment, that is certainly a benefit in that the more you can reduce contact points, the better off you are as far as disease transmission. For some facilities, that's not feasible. They don't have a stack of rescue tubes for one guard to have every day. So you'll have to look and see what is reasonable for your facility for that cleaning. And if you are using shared equipment, obviously cleaning it between uses would be the best practice. For lifeguard rescues, I do want to say this, and this is echoing what Michelle said earlier. If you're opening and you are allowing bathers into your venue, you must be prepared to use all the skills that you have been trained with by your training agency and through your in-service training program. There is no real change to lifeguarding rescues. We must still enter the water and make contact rescues. We must still provide resuscitative care and other care for various medical emergencies. We do see a reference from the American Heart Association in their interim guidance for healthcare providers, where they recommend outfitting your resuscitative equipment with HEPA filters. So that is one thing that facilities should look at doing. You definitely want to contact your manufacturer, whether that for your bag valve mask or for your personal resuscitation mask, to make sure that it's being equipped appropriately. What you don't want to do is try to fashion a self-made HEPA filter, because that could actually have more detriments in reducing tidal volume from BVMs and other equipment. We are also seeing a trend in recommendations to where lifeguard staff do not use the personal resuscitation mask, but shift to using BVM specifically to help reduce that contact transmission and to make that unlikely occurrence even lower. So those are some things that we are seeing. The other big thing for discussion is lifeguard training programs and how do we modify our training protocols. First off, the Model Aquatic Health Code only indicates what are the essential topics that should be covered in lifeguard training. Modifications to lifeguard training are at the sole discretion of the training agency. I will say that there are several strategies that have been discussed, whether through appropriate screening and training modifications. So please, if you're an instructor, defer to your training agency for those. I will say that it's going to be very difficult to do some components of lifeguard training while social distancing is in place. So it is going to be very difficult to do some of these things. We have seen successful strategies where agencies have converted and started using heavily blended learning and online learning options. That is certainly viable. We have seen some agencies and some facilities that are using water rescue mannequins to simulate victims, to where we can move along with single rescuer skill sets. Please defer to your training agency on those items. Most training agencies at this point have released guidelines on how to successfully integrate modifications into the skills. So again, it's very important to follow those. And the unfortunate answer is, when it comes to some of the group and team skills, if you are in a jurisdiction where social distancing guidelines are still in effect, it may be difficult to have that level of training. I want to encourage everyone to make sure that you're looping in not only your training agency or their guidance, but also that you're contacting your local health jurisdiction to see what they believe is feasible and can be done. So we do look at those possible modifications. So next slide, please. When we talk about water playgrounds, when we talk about interactive water venues and water features, this again has been a hot topic for conversation in a couple of different aspects. When we look at features that do create aerosols, we want to go back and refer to proper disinfection. Echoing what Jen said earlier, the data shows that, or indicates rather, that the risk of transmission from properly treated water is very low. So you want to maintain that you're holding on to your best practices. So there's no evidence right now to indicate that a concern exists from aerosolization of water through water features, as long as you're following your code compliant and MAC compliant guidelines. With high touch surfaces and shared handholds, this is where you as an agency and as a facility have to determine what you're willing to accept. In some facilities, the touch is so frequent that they have decided to not operate those attractions. That is not a mandate. That is an individual agency decision. So as a facility and as a health official, you need to look and see, all right, are we able to maintain proper cleaning practices with these items? Are we able to maintain proper social distancing with these items? And that needs to be in your discussion on whether or not you should open those venues. But again, from a water standpoint, a water quality standpoint, if you're maintaining proper code compliant chlorine levels and pH levels and circulation levels, as well as filtration, the risk is very, very, very low, and the water is generally considered to be safe. You do also want to be careful about modifications, where when you are modifying a piece of equipment, that you're consulting your engineer and your designer with that, there are some modifications that can actually create an unsafe situation. Now, Michelle wants to jump in, and she has something to add to water playgrounds and interactive water features. Michelle?
Yeah. So with water playgrounds, I think they're going to be a bit challenging with the social distancing. I think, and it's also going to depend on the setting. I think if you're more in a water park setting where there's a lot of staff around, you can dedicate staff to doing the social distancing. I think it becomes more of a challenge when we have these water playgrounds that are sitting in the middle of a city, in the middle of a city park, and because they're not a drowning issue, they've never been staffed before. So our city and state and local governments are going to have to think about whether or not they want to open these water playgrounds, since they don't have the staffing already. And I know budgets are stretched by COVID as it is. So that's just something to be thinking about as well.
Yes, absolutely. And that does bring up one point in that with this novel virus, there's a lot of things that we're just unsure of. And there's going to be a lot of things that have to be a local decision. Do we have the staff to do it? Is it financially feasible to operate. So those are all things that operators and public health officials will have to strongly consider when looking at these particular venues and any venue in general with their reopening planning. Next slide, please.
Okay.
So
do you want me to take these?
Yeah, go ahead, Michelle.
All right. So indoor and outdoor pools. This question. Oh, I'm not sure why I'm getting feedback. This question has been coming up a lot regarding what do we do about indoor and outdoor pools. Specifically, when CDC addressed the issue of indoor pools, we talked about making sure the ventilation system works really well inside, that it's working optimally, as well as, if it is safe to do so, leaving the doors open, windows open, letting as much fresh air and clean air to come in as possible. I don't remember all the questions that came in, but that's kind of what we were thinking about, just getting fresh air into the indoor pool versus not even having to worry about ventilation in outdoor pools.
Yes, and just to piggyback off that, again, we're dealing with a lot of unknowns, and we all want to make educated guesses and assumptions, but when we see a lack of specificity, we have to remember that that lack of specificity simply means that we don't have adequate data to make one decision or another. So, again, very good guesses and estimations based on existing knowledge and data. But for some of these questions, we just don't have the empirical data to say one way or the other. So we see that possibly reflected in some of the broader guidelines.
The other thing I would add to this is one issue we see come up a lot in the winters with aquatic venues is the issue of chloramines and outbreaks associated with chloramines. And this is due to the fact that not enough fresh air is being brought in, and part of it might be a motivation to cut down on heating costs, and bringing in cold, fresh air becomes an issue. So that's something we're definitely going to have to be thinking about going into the winter season this year, bringing in enough fresh air to indoor pools.
Absolutely. Michelle, one other kind of related question. When we look at most dehumidification systems, typically what happens is there is a reduction in fresh air coming in to reduce in heating costs, cooling costs associated, and operational costs associated with that dehumidification system. In keeping with the concept of getting more fresh air in, would it be fair to say that facilities should consider, in conjunction with their mechanical operators and their manufacturers, possibly upping that percentage of fresh air coming into the area, into the space?
Well, CDC's Model Aquatic Health Code speaks to air exchanges and systems. What we're going to look at in terms of this many air turnovers, we haven't gotten that far, or we haven't thought that far. But what we do have is recommendations that right now state you want to keep your doors open, and maybe that's an option for the winter, I don't know. And you definitely want to make sure your ventilation system is working optimally. I've also heard issues about, marketing people coming in to aquatic venues and talking about, having to install UV systems into ventilation systems. At this point, we don't have any data to support that. If the virus that causes COVID-19 gets into the ventilation system, you would have to re-aerosolize it for it to become an issue, and that's what we're thinking right now. That's not really a big risk. So at this point, it's about making sure the ventilation system works well, keeping doors open, and as more data become available, guidance might change as to how to do ventilation for indoor pools in the winter.
Great. Thank you, Michelle. From a water quality standpoint, we do have one question about, do we treat an indoor pool and outdoor pool differently? I mean, that answer is going to be, it depends. Some facilities with outdoor pools opt to use cyanuric acid, others do not. The basic chemical parameters don't necessarily change with the exception of isocyanuric acid for indoors versus outdoors. I do want to give a reminder that cyanuric acid should not be used at indoor pools at all. And also look at the work done by the Isocyanuric Ad Hoc Committee, which released a recommendation for a 20-to-1 ratio for cyanuric acid, meaning that for 1 part per million chlorine, the maximum CYA is recommended at 20 part per million.
Just to add what you're saying, Julie, cyanuric acid also should not be used with hot tubs.
Absolutely. Thank you, Michelle. So when we talk about recommended disinfection levels, again, just echoing, the data that we look at seems to show that normal levels of available sanitizer is sufficient. So whether you're using chlorine or bromine, please follow your code compliant, MAC compliant guidelines for those disinfection levels for pools and for spas. There is no indication right now that we need to run higher than code compliant levels of disinfection of sanitizer. What we have appears to be certainly fine and adequate for disinfecting the water for COVID-19. There's also no reason to hyperchlorinate before reopening unless you fall into certain groupings, such as this is your initial reopening and you have a pool with visible algae. You have obviously a concern about fecal contamination, or if your spa has been closed for a long period of time. And I'll ask Michelle to mention that at the end of this slide. So from this point, I want to turn it back over to Michelle to talk about pool water as a sanitizing agent, processes for restrooms, and again, any additional disinfection, specifically for other bacteria and Legionella.
The CDC has guidance for reopening hot tubs and spas and other water systems, but as far as disinfection is concerned, I'm gonna defer to Jen.
Sorry about that. That cut out just a little bit. Could you repeat that for me, please?
So Jen, if you wanted to talk about using pool water as a disinfectant, disinfectant.
Yes. So I kind of mentioned that earlier. I think we know that chlorine is effective against many bacteria, most bacteria, viruses, and I think this is probably not going to be different in terms of this particular virus, though we do not have the data yet. Don't have CT values. There haven't been a whole lot of studies yet for the virus in general, but specifically related to concentrations of chlorine found in pool water. So I think what we're kind of doing at this point is just thinking of this in a similar way as other viruses. So, maintaining these regular residuals within the pool for your regular routine operations and monitoring, but not utilizing pool water as a disinfectant per se for a specific surface or object. So really going in and using a much stronger chlorinated solution or other type of product for fast, efficient, effective disinfection of these surfaces so that you can reuse those particular items or be able to have a disinfection that's quick on those particular surfaces routinely throughout the day. So yeah, I think, until we know more about the behavior of this virus and different, against different disinfectants, that's the safest approach right now.
Great, thank you. Michelle, I'm going to toss this your way. When we talk about reopening for specifically for Legionella, some of our facilities may include spas that were shuttered and mothballed due to furloughed employees. So just a quick overview, what are the recommendations from CDC on reopening spas that have been closed for a long period of time?
So basically, it is hyperchlorinating the hot tub as if there was an outbreak caused by Legionella. So as if you had a Legionnaire's disease outbreak tied to the spa or the hot tub. So it's about draining the hot tub, refilling it, running 20 parts per million. I believe it's for 10 hours. I'd have to look it up, but it's not quite the hyperchlorination used for cryptosporidium. And then possibly, if the hot tub has had a history of issues with Legionella, testing before reopening. And that's really a discussion between the local health department and the operator to see if testing needs to be done before reopening.
So just to clarify, for general pools without that history of Legionella, is there any need to test the pool for Legionella or bacterium in any body of water, absent that history?
So when we think Legionella, we think about water being aerosolized. So we're not really that concerned about pools, but we are concerned about hot tubs. And if the hot tub has had a history of outbreaks, if it has a history of failed inspections, the local health department may choose to have that hot tub tested before reopening. The other thing is the operators themselves might choose to test before reopening, but that then becomes if the local health department or state health department isn't saying that testing needs to be done before reopening, that becomes a choice of the operator.
Great, thank you, Michelle. We've also had several questions that are operational in nature, and before we kind of hit some of these, I do want to reiterate that from an operational standpoint, there's going to be many things that as a facility you would have to look and decide on based on multiple factors. And again, those are the ability to maintain social distancing, the ability to adequately clean and sanitize surfaces, and does it make sense for you to operate? Are you able to operate from a local standpoint? We've had several questions about bather load related and accommodating different bather loads. Again, while social distancing is in place, facilities will have to look and identify ways to enforce that and to recommend different social distancing strategies. In some cases, this may be offering reservations for families for an open swim time. In some cases, it may be restricting young children that traditionally have a difficulty in maintaining social distancing. It may be that you only offer lap swim with one person per lane to enforce social distancing. All of these are items that you're going to have to consider from an individual standpoint as a facility. And that holds true whether you're a facility operator or even a public health official. There's been a lot of conversation already about locker rooms and public restrooms. That has been included in CDC guidance. Considering safety precautions for facility staff, we see recommendations to have screening questions. That is certainly in place. And also those helpful employee practices mentioned in the CDC guidelines. Same thing for COVID-19 precautions in the facility EAPs. Making these reasonable and well thought out accommodations, including modifying your response to include BVMs and other ways that we can help keep our staff and our general public safe in our emergency response. And again, we see the same thing with lap swim and open swim protocols, where we're looking at social distancing and how can we operate as facilities and still maintain proper social distancing. I wish I had better news to say that these were very, very specific recommendations. But at the end of the day, operators should remember that the goal is public health, and then how can we modify what we're doing as operators, our bather loads, the number of people in our building to comply with the CDC guidelines and also our executive orders from our various governors and municipalities. So we're dealing with hard questions, and I want to acknowledge that all of these things are very, very difficult, but they're also very much localized questions that facilities have to answer themselves. So that makes things rather interesting from an operator standpoint. Next slide, please. So before we get into the open Q&A, I want to turn it back over to the staff from CDC. And just very quickly, what have we learned from past epidemics? What do we kind of see maybe coming in the future? And then I'll talk about economic sustainability. But Michelle, Jen, Joe, these first two questions, what are thoughts from CDC on these items?
I don't think we've seen anything impact aquatics the way we potentially see COVID impacting aquatics with the closures of whole communities, states, and possibly you could say the whole country to some extent. I think what we need to do moving forward is, when we wrote the guidance, we tried not to be prescriptive at CDC. We tried to acknowledge the fact that aquatic venues really vary across the country. And what's really important here is we're all supposed to be operating and managing pools according to local and state requirements. There's also the resource of CDC's Model Aquatic Health Code to help with that. And now on top of it, we are going to have to manage and operate our pools while implementing the pillars of COVID-19 prevention, that being wearing of the cloth face coverings, the hand washing, the social distancing. I think if anything, moving forward, the best thing we can all do is talk to each other and learn from each other. None of us has done this before. We've all lived life a certain way up until now, and now we're being asked to change. We're being asked to change how we go to grocery stores, how we're going to go to pools, how we're going to operate pools. So instead of each of us learning how to run a pool during this pandemic, it's really going to be about us communicating with each other and sharing lessons learned. Instead of everybody learning the same lesson 1,000 times over, it is about talking to each other and learning from each other. What works, what doesn't. Multiple pools have slides, so how are we going to manage the line going to the slide if the slide is open? The other thing is please take CDC guidance as our first step. Again, like everybody else, we've never done this before. There are a lot of questions. This was our best guess based on what we know on how to operate and manage pools during this pandemic. We will, within a couple weeks, go back to our public health colleagues, go back to our aquatic sector partners, and ask them what works and what doesn't. How can we optimize the guidance? I think the real messages here are to just really be flexible. New stuff's going to come out, new data are going to come out, new guidance is going to come out, and we're going to have to change the way we do things, even as the summer goes along. And I will warn everyone that just because we're allowed to open in May or June or July, that doesn't necessarily mean we'll be open all summer. The numbers, the case numbers, the deaths could change in a community, and that means, there is the potential for shutdown. So I really think patience and flexibility are the name of the game, and sharing lessons learned.
Absolutely. When we talk about economic sustainability of aquatics, this is a if you operate a pool, this is a hot topic and has been for a very long time. It's been well known for many years that aquatics is an expensive operation. I wish we had a crystal ball to where we look and see what the future holds from an economic standpoint for the aquatics industry. And I even wish we had a mechanism to where we can have really good answers. So everything about the economic sustainability is just purely going to be speculation at this point. We know that the industry is facing unprecedented challenges. We know that there are many facilities that are closed and some may not reopen. We know that some are not going to reopen. We know that we're seeing waves of impact from not only the revenue from a single pool, but also the secondary impacts from operating a pool, from staffing and their impact on local businesses and purchasing. We see secondary impacts to pool service companies, some of which are struggling now, pool management firms, all of and even manufacturers. All of these are facing unprecedented impacts. We know that, the next year and a half or however long it takes to get to the other side of this pandemic are going to leave massive, to use maybe a word poorly, but scars on the industry, where we will all be sitting down and thinking, how can we operate in a more sustainable way? And again, unfortunately, much like local guidance, those are local decisions on how these facilities can move forward. I personally have a great fear for the water park industry. The water park industry is especially susceptible to these type of economic fluctuations, and many water parks are not able to open at one of the most critical times of the year for their operations. So I personally am concerned about what will happen to the water park industry as a whole, as well as those secondary impacts on the equipment stream and those vendors. Same thing with pool management firms, where many of those are being severely impacted and having contracts canceled because the facilities aren't opening this year, or we'll see delayed openings. So the economic question is a huge one that unfortunately we don't have any real good questions. It may drive a desire to see aquatic facilities do become more sustainable. What that looks like is everyone's guess. So I do want to mention, as we move into the Q&A, that I want to backtrack to the isocyanuric acid issue and just make a clarification. The CMAHC put together an ad hoc committee to start looking and addressing the issue of isocyanuric acid in swimming pools. That is a very intelligent group of individuals. I had the pleasure of being on a call a couple of weeks ago, and I can testify the level of concern and care and sheer knowledge is absolutely amazing from that group. But I do want to mention that there is a little bit of a disagreement in that the 20-to-1 ratio that we've seen publicized in other articles was not a consensus. The ad hoc committee is still split on that issue, where some are recommending the 20-to-1 ratio and others are recommending a 50-to-1 ratio. I do want to say that CMAHC is wanting to help support that group in their research, and we look forward to working with the ad hoc committee and those scientists and experts, and hopefully in the years to come, we'll have some really good information and good data to come out to help drive the isocyanuric acid, cyanuric acid conversation. So definitely a thanks to that entire ad hoc committee for the hours and just months and years of countless work they put in. With that being said, we do have a third poll question, if we can advance. So again, we'll give you about another minute to respond. So this poll question, do you have any concerns about reopening and then required to shut down again, right? Do you have concerns about keeping your staff safe and protected? What about your patrons? Are you concerned about financial sustainability if your bather load and facility use was capped to a low percentage of occupancy? And how concerned are you about programming? So again, we'll give you approximately 1 minute to answer these questions. Great. Thank you, everyone, for responding. So yes, we see a lot of good information here, and it shows a lot of concern among the industry that is certainly felt by every operator. Thank you to everyone for responding to these polls. So at this time, we want to bring all of our panelists back in, Michelle, Jen, and Joe, and we want to open up for a question and answer. So you've been submitting questions to CMAHC throughout the entire presentation. I also want to bring on Susan Wichman, who is our Administrative Director Extraordinaire, who will help facilitate the questions.
Okay, Dewey. Apologize for that. I had to get off mute. We still have quite a few questions about lifeguarding and PPE. One question about how to explain to the parents that their potential lifeguards are going to be safe.
So for the question about are the lifeguards going to be safe, you know, that's a difficult question to answer. There's been a lot of concern throughout the entire industry, and we've seen that come up on occasion after occasion after occasion. And like everything, we don't have a lot of good answers. You know, that's where facilities have to come up with a stellar plan to help protect employees and protect staff, and also a stellar plan in responding to the event that a case is identified related to that facility. And CDC has great guidance on what that looks like and could look like in that response. And facilities need to be prepared for, especially for many of our lifeguards who are minors, for them to not be comfortable working in that environment. That is something that is definitely an issue that we've seen in various facilities, where the parents are not comfortable with their minor children working as lifeguards and being exposed to COVID. I would recommend that facilities be very sensitive to that and try to accommodate as best we can. You know, and at the end of the day, those concerns may ultimately impact our staffing. But again, facilities just have to come up with a really good plan, the best plan they have, and try to educate and try to promote that with their staff and with parents, and be open for conversations.
Very much. Michelle, I would add to that, oh God, I'm getting a lot of feedback. I would add to that The American Heart Association put out guidance for how to do resuscitation, CPR, during the pandemic. CDC has guidance for EMS workers, and maybe I can share a link with CMAHC, and you guys can share that, where it talks about, addressing issues where there's aerosolization as well. And it is, to some extent, it is going to have to be, we are doing the best we can based on the data we have right now, and you're trying to keep informed about as things change, whether it be through the CMAHC or through the American Heart Association or the Red Cross that does lifeguard training, just how to do this the best way possible given what we know now.
There's also been some questions regarding face shields, goggles, gowns, filters, and gloves in case of an emergency requiring resuscitative care. Shouldn't they have a kit available? And also regarding N95s for lifeguards when performing CPR or providing first aid. Some argue that because CPR is an AGP, that lifeguards should be wearing N95s.
This is a really interesting question from a response standpoint, and I've got to be careful not to stir the waters too much here. But there's definitely an ongoing discussion about lifeguarding responsibilities, and the pandemic is definitely highlighting that as to their questions of, if we consider lifeguards as healthcare providers, should they be wearing healthcare provider level protections? And these things have always been available to us. It's not like anyone has never said that lifeguards should never wear gowns and gloves and face shields and N95 respirators. It's just by nature of the business and what we do, we don't see necessarily that kind of trauma that would require gowns and gloves and face shields. But as we move into this new era of COVID-19 and the highlighted emphasis on community spread, then these are things to consider. Again, I would encourage you to look and see what your local protocols are, what your local guidance is. Defer to your training agency. Defer to your medical guidance for your facility if that exists. These are things to be considered, certainly. I don't necessarily see a mandate. They're more a philosophical approach about how do we view lifeguards. We know the minimum of having, non-powdered gloves, nitrile gloves, and breathing barriers exist. We know the use of BVMs are highly encouraged. The rest of the equipment, again, is going to be a philosophical issue that, honestly, that's going to be an interesting discussion. We're not set up for it, but I would love to hear the input from the training agencies on how they view those additional protective measures.
Can I
Absolutely.
If I can add to all this discussion, I think first and foremost, we got to remember what CDC has come out and said about masks. They're asking us, members of the public, to wear cloth face coverings because we need to save the masks for the healthcare providers, the first line workers. And so when we're talking about doing a rescue and doing resuscitation, if there is a regular mask, like a regular surgical mask, the blue masks that we associate with healthcare providers, if you already have one and you're around the person, I would defer to that before anything else. And when we're talking about N95 masks, we're talking about for them to work properly, we're talking about being fit tested, so making sure that they fit our face properly so that they work properly. We're talking about testing how well we breathe before we use them. So N95 respirator masks really shouldn't be part of the conversation around here. I remember when we're talking about pools. When Dewey said earlier with the HEPA filters, yes, both CDC and the American Heart Association have come out and said there should be a HEPA filter on the bag valve mask. In terms of gowns and all this other stuff, I would check to see what the American Heart Association has said in terms of wearing that, and there's also the CDC webpage for EMS workers and what they should be on the lookout for in using. So I will be sure to pass that on.
And this is Jen, and I'm sorry, I'm going to actually have to jump off this call here in just a minute, but just wanted to also just note that the cloth face covers that CDC recommends are meant to be a source control. So that means that they are protecting, mostly it's meant to protect others from asymptomatic spread. So they're not protecting the wearer necessarily, they're protecting others who are around someone who might be infected and not know it. So it's actually a source control versus a personal protection. And so I think that's a detail is not necessarily straightforward a lot of times. But I agree with Michelle. What we're seeing in most of the country right now are severe shortages in respiratory protections for people who are in wards who are dealing with multiple ill patients and not really being able to protect themselves. And certainly we want to make sure that our healthcare providers that are in the most, the most high-risk settings have what they need. And so that's why CDC's kind of turned towards this cloth face covering and not really promoted the use of any types of other types of PPE for the general public. But I do recognize that, there is concern around lifeguards and they are performing a life-saving measure. So I can see there's some gray area there, and certainly something to discuss, longer term within the group about what are the best ways to protect the lifeguards. So with that, I'm sorry I have to go. I've got another webinar to get to, but thank you all so much today for inviting me to participate. And we look forward to any feedback you have over the coming months as these pools start opening and the considerations are put into place. So thanks again.
Thank you, Jen. Michelle, I have one question I want to address before we move on much further. We have a question about why is there a recommendation to wait 24 hours before cleaning and disinfecting surfaces after coming in contact with sick individuals?
So you're waiting for the droplets to settle? So this is for the protection of the person who's doing the cleaning.
Great, thank you.
Cleaning and disinfecting, sorry.
And we have questions about locker rooms and restrooms. If the locker rooms are not being utilized in a facility, how do you encourage showering before swimming? And then if the locker rooms have been dormant for a while, is there a special flushing of the systems in there that needs to be done?
So in terms of locker rooms, that's something that operators are going to have to work out with the local jurisdiction. I mean, you're going to have to provide restrooms. You're going to have to provide for your patrons and for your staff. So how your venue is configured is going to matter. So that's a conversation that needs to occur locally and probably venue by venue, whether or not restrooms and locker rooms are open and how and where and why. In terms of, what was the second question? I'm sorry.
The second question was if the locker rooms have been dormant for a while.
Okay, so
do they want to flush the hot water system?
So the guidance that I mentioned earlier about how to reopen a hot tub that's been closed for an extended period of time in a way that prevents a Legionnaire's disease outbreak. There's also guidance for other water systems on that page as well, so I will make sure that link, we'll send that link for you all to share with the attendees.
Great. And then there's questions about, I appreciate the dilution consideration. What is the dilution rate of COVID-19 dispersed in the air at a distance of 6 feet?
I do not know the answer to that, but I can follow up on that.
Michelle, this is Joe. Do we have any, does CDC have any recommendations about using other types of material to make face mask, in particular bathing suit material or waterproof bathing suit material? There were a couple questions like that in the Q&A as well.
Oh, that's a great question. That one has been coming up a lot. So basically, CDC currently recommends that you take a t-shirt, a bandana, or cotton to make your face mask, not, for example, Lycra. We do have a question that went to the group that deals with the masks, and that we have not gotten an answer back if the Lycra is correct, but is okay. But right now, CDC is only recommending cotton and bandanas and t-shirt material for the cloth face coverings.
And then another question is, would the 24-hour measure apply to an outdoor situation for clean?
I would have to look specifically at the guidance, but I will get back to you on that. I believe so, but I need to look at that.
Susan, we do have one question I'm going to hop in and answer. So there's a question about CPR. There's been some discussion and confusion about the use of ventilations in CPR. Just about all the training agencies have moved to some form, either a non-certification course or including it in a certifying course, where breaths are eliminated from CPR and they're using compression only. Not enough time to get into all the data behind that, but I will say that that is intended for lay responders only. For individuals that have a professional response level certified, for example, lifeguards, CPR still includes providing ventilations.
Okay, and then we have a question about, is there consideration being given to water vapor mist above the pool surface to bring any airborne virus into the water where it's more easily killed? We know that airborne viruses represent the highest degree of transmission, so the sooner we get in the water, the better. And then can this be distinguished from airborne transmission?
I'm not sure I understand what's being asked there. So airborne is a little bit different than what we're talking about here with droplets. So when we're thinking about airborne transmission, we're thinking about something like tuberculosis. So the particles are small enough to get deep into our lungs. When we're talking about COVID-19, we're talking more about droplets. So this is about coming in contact with our mucous membranes and going down into the respiratory system. But these are much bigger particles and they don't get as far along into the lungs. Can we clarify?
And then a question about masks. They've purchased masks in a swimsuit material for parents standing in the water with little ones. However, I would think that we as operators would require the mask unless someone is actually going swimming. Standing in the water watching your small children would be the same as sitting on the deck as far as that I would be concerned. Why are you looking at that differently?
Yeah, Michelle, there's quite a few questions along that line of if you're standing in the shallow end of the water wearing a mask, if you're an ankle deep, what's the difference between that and standing on the deck?
So
Basically, is it okay to wear a mask when you're in the water?
So overall, we're saying don't wear a mask in the water because the CDC is recommending cotton masks, and when they get wet, you really can't breathe through them. In terms of if you're in ankle deep water, I think there is some flexibility with that, but overall we say don't wear it in the water. But I will work on getting that clarified. I want to make sure we're consistent with what CDC, what all of EOC is saying, so I can follow up on that.
And then within a year or two, there could be a majority of humans exposed. At that point in time, do we revert back to practices before COVID-19 outbreak? Or are these new measures temporary?
I think right now it's too early to say how these measures are going to play out and for how long. Keep in mind, we're not even clear that if you get reinfected, whether you can get sick again or not. So I think as we learn more, we'll get a better sense of how to best move forward. There's a report today that there's a new medication potentially out in China. There's a report yesterday that there's a promising vaccine in the media. So there's a lot going on right now, and we're still collecting data, and I think we just need to be patient and see how a lot of this plays out. I know that this is really stretching all of us, both physically and mentally and emotionally and every other which way, the situation. But right now, none of us can say how long this is going to play out or how it's going to play out.
I think that pretty much covers the Q&A. If there are questions that you had that weren't answered, you can always email cmac@cmac.org, and we'll do our best to get those answers for you. This webinar will also be posted later, and you'll get an email about that as well.
We want to thank our panelists for their time and their expertise today and their diligent work in working for this COVID response period, whether it be in aquatics or for the general public. We also want to thank all of you, our attendees, for sending in your questions and for participating. Your input and support of CMAHC is invaluable, and we certainly are looking at ways to where we can get you, our members, more involved and serving the industry, and also us serving you. So a big thank you to all of you, not only for CMAHC membership and participation here, but also for what you're doing in your communities from a pool operation standpoint, from a public health standpoint, or whatever role you serve. You are making tremendous impacts in public health and safety as it refers to swimming pools. We want to thank all of our CMAHC staff who've put in a lot of work to create this webinar and to compile these questions. We have a very excellent, just top-notch crew for all of our staff members, and I am thrilled to be able to work with the level of professionalism and knowledge that each one of these individuals demonstrate on every single day. Stay tuned to CMAHC. We have a lot of things that are lined up. Of course, we have our Vote the Code coming later in the year. So please pay attention to updates on the change request review process and educating yourselves to where you can have a voice in the Model Aquatic Health Code for the 4th edition as we move into voting. We're going to open up for a second round of comments somewhere late July, early August, with the vote happening this fall. So again, that is your opportunity as a professional to have a voice in the direction of the Model Aquatic Health Code as we improve it for public health as recommendations to the CDC. We have a lot of things lined up for the future. It's an exciting time for CMAHC, an exciting time for the aquatics industry. And I hope everyone stays tuned and stays involved as we start rolling out some really exciting things in the future. I do want to give one major shout out. We are in the process of releasing the information, but CMAHC does offer a certification program for a wide variety of services, for applications for product, online applications for products, and for training agencies. We want to give a massive shout out to StarGuard Elite, who went through the CMAHC certification process for the Lifeguard training program. I can say with certainty it's a rigorous process to seek compliance with the MAC. And they were the first training agency to achieve CMAHC certification. So definitely, send your congratulations in to the staff at StarGuard. And we look forward to working with the other training agencies in the future on CMAHC certification as well. Thank you all. We value your input. We value your participation. We hope that you stay safe. We hope that your family stays safe. And that ends today's presentation. Thank you, everyone.